Hello everyone, welcome to Mid Adventure. In today's episode, we'll be having a discussion on why radiology access is a global health issue. When people think about global health challenges, they often think about infectious diseases, malnutrition, or shortage of medications. However, one issue that receives far less attention is access to medical imaging. Millions of people around the world still lack timely access to X-rays, ultrasound, CT scan, and MRI. Yet without imaging, diagnosis itself becomes difficult. Radiology plays a central role in modern medicine. It helps physicians diagnose disease, guide procedures, monitor treatment, and make urgent clinical decisions. Despite this importance, access to medical imaging remains highly unequal across different regions of the world. In this video, I want to discuss why radiology access is not only a medical issue, but also a global health issue. Radiology access means more than simply owning imaging machines. It includes the ability of patients to receive appropriate imaging studies when they need them. This requires trained radiologists, technologists, functioning equipment, stable electricity, internet systems, healthcare infrastructures, and affordability. In high-income countries, advanced imaging is often readily available. Patients may receive CT scans or MRI within hours. However, in many low-resource settings, hospitals may lack imaging equipment entirely, or machines may be outdated, broken, or difficult to maintain. Some patients travel long distance just to obtain a basic imaging study. Others may never receive imaging at all. Medical imaging influences nearly every field of medicine. In emergency care, imaging helps identify internal bleeding, fractures, or stroke. In oncology, it helps to detect end-stage cancer. In obstetrics, ultrasound plays a major role in monitoring pregnancy and maternal health. In pediatrics, imaging assists in diagnosing congenital abnormalities, infections, and trauma. Without imaging, clinicians are often forced to make critical decisions with limited information. This can delay diagnosis, increase complications, and affect patients' outcome. Radiology is not simply an option. In many cases, it is essential for safe and effective healthcare. One of the major global health challenges today is unequal distribution of imaging resources. Some regions face severe shortage of radiologists and imaging infrastructure. Settings like rural hospitals may lack imaging equipment such as CT scans or MRI entirely. Even when machines are available, there may not be enough trained professionals to interpret the studies. This creates what many experts describe as the global imaging gap. The imaging gap affects patients in many ways. Delayed diagnosis can lead to more advanced disease at presentation. Limited imaging may also reduce the ability to perform image-guided procedures or monitor treatment effectively. In resource-limited settings, healthcare providers often work under significant constraints while trying to deliver the best care possible. Among all imaging modalities, ultrasound has become one of the most important tools in global health. Unlike CT or MRI, ultrasound is portable, relatively affordable, and does not use ionizing radiation. Portable ultrasound devices can be used at the bedside, in rural clinics, emergency departments, and even in mobile healthcare units. This flexibility makes ultrasound particularly valuable in areas with limited resources. Ultrasound is also increasingly used for image-guided procedures. It can improve procedural accuracy and reduce complications while avoiding radiation exposure. Because of its applicability and adaptability, ultrasound may continue to play a major role in expanding imaging access worldwide. Technology is already helping improve radiology access in many parts of the world. Tele-radiology allows imaging studies to be interpreted remotely by radiologists in other regions or countries. Artificial intelligence tools are being explored for tasks such as workflow support and image analysis. although the implementation remains uneven across different healthcare settings. Digital imaging systems and cloud-based platforms are improving communication and collaboration between healthcare providers. However, technology alone is not enough. Sustainable progress also requires investment in infrastructure, equipment maintenance, education, training programs, and healthcare workforce development. In summary, radiology is often associated with advanced technology, but access to medical imaging is also an important public health issue. As medicine continues to advance, expanding access to medical imaging is increasingly recognized as an important global health priority. Thank you guys for watching. If you enjoyed this discussion, feel free to like, subscribe, and share your thoughts in the comments below.